Glad to participate this conference. The topic that I'm gonna talk about today is what contributes to the progression of rheumatoid arthritis. I'm a PhD in clinical research candidate, and this topic is we actually like to divide our job into actually sections. So I started table of contents, which will be rheumatoid arthritis definition, historic background, what causes rheumatoid arthritis, diagnosis and investigation, and then we talk about clinical features, what are the roles of exercise, what are the treatments that's available, and finally we will conclude with the conclusion. Rheumatoid arthritis is an autoimmune disorder that affects joints such as hips, knees, hands, maybe fingers, and all joints. Rheumatoid arthritis is the most common autoimmune disease and inflammatory disease in adults. However, autoimmune disease is not popular as in children as adults. So maybe children, they have joint and limb pains, which is not rheumatoid arthritis. However, adults have got prevalent in rheumatoid arthritis. So this autoimmune disease particularly targets synovial tissues that is the connective tissue that lines the inner surface of the synovial joints and tendons. So this particular disease targets that tissue and cartilage and bone and causes inflammation and stiffness in the joints in the joints and the tissue surrounds. If we talk about the historical background, rheumatoid arthritis existed since 200 BC, which is before Jesus Christ, and there are evidence for existence of rheumatoid arthritis in various areas and locations in the world in that time or even after that time. The existing evidence came from the analysis of ancient texts as stated by Boaya et al. Article written in 2011. However, some scientists say the fastest time this disease recorded was 1800, and those who are arguing this are Austin Jacob Lander. And however, there are other arguments which says the term rheumatoid arthritis was introduced by Garrod in 1859. So the question is, what are the causes of rheumatoid arthritis? The rheumatoid arthritis is an autoimmune disease, as we said, but it has no etiology or causes known so far. Nobody knows what the causes of the autoimmune disease. Several factors may mainly contribute to the initiation and the progression of the rheumatoid arthritis. This may include gender or age, environmental factors, malnutrition, genetic makeups, and maybe other factors. There are a variety of cells play the role, they play a role in rheumatoid arthritis disease progression. such as macrophages and maybe other white blood cells. And once the synovium's macrophages are capable of antigen presenting and T-cell activation. Diagnosis and investigation. Patients with rheumatoid arthritis usually present with chief complaint of pain and stiffness in many joints, such as wrists, proximal interphalangeal joints, and metaphalangeal joints are the parts of the body where inflammation takes place. That is in the joints and the end of the when the fingers meet. During the medical examination, synovial thickening is observable and also palpable on joint examination. Joint discomfort or arthralgia is common sign that patient presented before the onset of clinically apparent joint swelling. Diagnosis and investigation. Then the diagnosis relies on the clinical feature. The American College of Rheumatology criteria are shown, are useful for epidemiological and investigative study, but they are unhelpful in early disease. Blood count and anemia may be present sometimes. However, ECR and CRB are raised in proportion to the activity of the disease. There are always a clinical feature that doctors need to observe and see. The clinical features are fever lasting for 5 days or more, bilateral conjunctival cognition 2 to 4 days after onset, dryness and redness of lips and oral activity 3 days after onset, acute cervical lymphadenopathy accompanying the fever, morphopolic rash involving any part of the body, redness and edema of the palms and soles 2 to 5 days after onset, swelling of the wrist, metaphalangeal or proximal interphalangeal joints for at least 6 weeks, symmetric joint swelling, hand X-ray change, typically rheumatoid arthritis that include erosion or a bony decalcification, rheumatoid subcutaneous nodules, rheumatoid factors, and anti-citrullinated peptide protein antibodies, elevated acute phase of reactants, erythrocyte sedimentation rate, or C-reactive proteins. The role of exercise. Various studies show that moderate and regular exercise positively contribute the reduction of inflammation. Physical activity is composed of daily tasks, both occupational and leisure activities. Exercise improves arthritis and should coexist. Patients with arthritis who do daily exercise have less pain, more energy, improved sleep, and better day-to-day functions. The treatment that's available now. First thing that we need to control is pain management. Reducing swelling and preventing deformity is fundamental stage for effective rheumatoid arthritis treatment. So we start with giving non-drug treatment in the first time. Acute flare-ups rest the affected joints, use of day and night splints. The treatments that are available could be drug treatment, which is first line we give, or doctor is supposed to give, non-steroidal anti-inflammatory drugs like aspirin 600 to 1200 1200 daily, I mean TID daily, or ibuprofen 400 to 800 microgram of PO, which is 3 times daily, and indomethacin, especially during the night.